I am Dr. Archana. I am a consultant nephrologist at Renova Hospital, Kompally. Today I am going to discuss few questions which are commonly asked to me or to any nephrologist from the community. First question which is commonly asked is, what are the types of the kidney diseases, doctor? So I would like to give it, it's a very vast list, but I would like to give an overview about these diseases. The kidney diseases are broadly divided or broadly covered under chronic kidney disease, which is called as CKD, and acute kidney injury, that is AKI. So let us see what is CKD and what is AKI. What is the difference? CKD, as the name suggests, it is chronic kidney disease. That means it lasts usually more than 3 months. It is a progressive disease and it is irreversible. So there could be many causes of CKD like diabetes, hypertension, glomerulonephritis, any other disease which is causing permanent kidney damage will be included under this category as CKD. And this being a progressive disease, initially it can be managed with the medications, but eventually patient loses the full capacity of the kidney and the patient lands up with the renal replacement therapy, which is either dialysis or kidney transplantation. Now coming to acute kidney injury, as the name suggests, it happens acutely, that is over few hours or few days. And then the kidneys may shut down completely, or there will be various degrees of the kidney failure. Depending on the degree of the kidney damage, the treatment will be different for these patients. Most of the patients may require dialysis if the kidney failure progresses fastly and completely. But the good part about this illness is it is 100% reversible. So whenever the kidney damage happens and it is reversible completely, it is called as completely or even partially, it is called as acute kidney injury. And the common causes of acute kidney injury are dehydration, infection, then glomerulonephritis. Acute kidney injuries requiring dialysis will be mostly requiring hospital admission also. And this is considered as one of the major cause of mortality in the hospitals. Now coming to the other causes of kidney diseases like kidney stone diseases, urinary tract infection, glomerulonephritis, nephrotic syndromes, or inherited kidney diseases. I would like to give some idea about the inherited kidney diseases. Inherited kidney diseases are the diseases which are genetically transferred from one generation to the other generation. The commonest disease which we see in the community is the adult polycystic kidney disease or autosomal dominant polycystic kidney disease, that is called as ADPKD. Second question which is commonly asked is, doctor, how do I know that I have kidney disease? What symptoms do I see in myself to find out if I am having a kidney disease? Unfortunately, kidney diseases don't have any particular symptom to start with. There can be very non-specific symptoms like fatigability, giddiness, weakness, not able to eat. These are some vague symptoms which cannot be pointed directly only towards the kidney disease. But there are certain other symptoms which can take your attention, is swelling of your feet, or puffiness around the face, or puffiness of the eyes, around the eyes, or urinary abnormality like urinary burning sensation, or blood in the urine, or foamy urine, or the inability to control urine or passing more urine. Anything abnormal in the urination is also considered one of the symptoms of the kidney diseases. In advanced kidney diseases, patients may have like nausea, vomiting, loss of appetite, then breathing difficulty. These are the severe symptoms when the kidneys are damaged beyond repair. The third question which is asked usually is, Doctor, what are the risk factors for the kidney diseases? Which patient should be more careful about getting the kidney diseases? So, as we all know, diabetes is one of the leading cause of chronic kidney disease or any other kidney disease also. So, diabetes is the first one. So, if you are having diabetes or if you are having a family history of diabetes, you should be vigilant about it. Second is the history of hypertension. Patient is having high blood pressure. Any person having high blood pressure should be vigilant about the kidney function. If the BP remains uncontrolled for longer time, then it may have effect on the kidneys. Or sometimes there is an early onset of high blood pressure at early age because of the kidney problem itself. So, it should not be neglected. The third risk factor, if you are obese, that obesity itself is a risk factor for many kidney diseases. If you are a smoker, then you are at risk for the kidney diseases. If you are taking painkillers, over-the-counter painkillers without any doctor's supervision or doctor's advice, if you are taking it frequently, then the kidneys may get damaged because of the overuse of the painkillers. Then, if you have a family history of kidney diseases like diabetes, anybody in your family having diabetes, getting a kidney disease because of diabetes, then you are also at high risk of getting both the diseases. Then second thing is, as previously we mentioned, autosomal dominant polycystic kidney disease is a genetically transmitted kidney disease. So, if someone is mother or father is having this disease, then 50% of the children are at risk of getting this disease. The fourth question is, how do we diagnose the kidney disease? Because I just said that it is very difficult to give pinpoint symptoms for the kidney diseases. Then how to diagnose them? How do we diagnose it? So, usually we advise any patient who is having the high risk factors, as we mentioned before, should undergo simple blood test and the urine test. The blood test is to check the serum creatinine level. With the help of creatinine, we will estimate the GFR. GFR is the glomerular filtration rate. That means the filtration capacity of the kidney will be estimated or calculated with the use of creatinine. And there are certain formulas to calculate it as per the age, race and the sex of the patient. The second simple test is the urine test. The urine test is done for the protein leak. Patients having proteinuria, or to be very specific, albuminuria, when it is detected, then it is a marker of the kidney damage. So, normally less than 30 milligram per gram of creatinine is the normal, considered as a normal protein excretion or albumin excretion. If it is in the range of 30 to 300, it is considered as moderate, and then more than 300 milligram, it is considered as severe proteinuria. So, depending on the grading of this protein leak or the albumin leak, it is diagnosed as A1, A2, A3 stages of the albuminuria. And depending, as I mentioned before, depending on the GFR, we distribute this. It is classified as stage 1, stage 2, stage 3, stage 4 and stage 5. In CKD stage 1, the GFR is more than 90 ml per minute, which is almost normal, but they are having some radiological abnormality, that is abnormality in the scanning of the kidneys or in the urinary abnormality, or only the protein leak is there. So, this is called as stage 1, and the stage 2 will be having lesser than 90, that is 60 to 89 ml per minute GFR. Then similarly, as we move from stage 1 to stage 5, the GFR progressively drops. At the stage 5, it is less than 15 ml per minute. That means the filtration capacity goes down gradually as we move from stage 1 to stage 5. Stage 5 is also called as end stage renal disease, where most of the patients will be requiring renal replacement therapy. That is, as the native kidneys are not functioning well, the artificial kidneys, that is either the dialysis or kidney transplantation will be used. Other tests like ultrasound abdomen, that is the scanning of the abdomen to look for the kidney sizes, is also one of the tests to know whether there is any problem with the kidney or not. Along with that, there are certain specific tests which are done as per the presentation of the disease or the requirement of as per the clinical picture, like kidney biopsy or the immune connective tissue profile, or there are multiple other blood and urine tests are included in this. The fifth question which is asked is, as we are heading to summer, particularly in summer season, people ask us like how to take care of our kidneys. Patients who are already having kidney problems should be more vigilant about it, as well as even normal person not having any disease also should be taking care of their kidneys or overall health in summer because of increased incidence of dehydration, sunstroke, and we work many of the times, most of the people work in the IT sector or in the corporate field where they are working in AC and they forget to drink water. So that's how unknowingly they also land up in dehydration. And apart from that, the other class which works directly under sun is definitely more prone for the dehydration. So in both cases, we should make it a point to hydrate ourselves well with the water, and not only water but with other juices, fresh fruits, so that we will not be depleted of the water as well as other minerals. Patients who are having already kidney problems, so like stone diseases, urinary tract infection, patients who are diabetics or having any past history of chronic kidney disease should be more vigilant, and they should hydrate themselves as per the doctor's advice, and they should avoid exposing themselves in the sun and avoid painkillers, which is another major risk factor for worsening the kidney problem if the painkillers are taken. Lastly, I would like to give some general tips for the kidney health. So, be active, keep exercising, maintain your ideal body weight, eat healthy, reduce red meat and very high protein diet, particularly animal proteins to be reduced. Animal in the sense red meat particularly should be reduced to reduce the burden of your kidney work, and increase the plant-based proteins in your diet. Be active, maintain your ideal weight, quit smoking in case you smoke, limit alcohol consumption, avoid painkillers and hydrate yourself well. That's the way to take care of your kidneys. Thank you.